Well, we go to great lengths to bring you news of the latest in medical advancements, but this next story takes that to a whole new level. You may remember back in January when I told you that I had a skiing accident. Since that time, I underwent some cutting-edge surgery, no pun intended, that many orthopedic surgeons are just now learning about. It's called double bundle ACL, or anterior cruciate ligament reconstruction.
This is a more anatomically correct reconstruction, and it helps control not only the knee shifting forwards but also the rotation, and each bundle kind of does each motion independently.
Tonight at 6, you can see how Dr. Jimmy Tucker reconstructed my ACL using this procedure. And joining us in the studio tonight is Jonesboro orthopedic surgeon Dr. Brian Dixon, who has performed more than 15 of these new double bundle procedures. And ACL surgery has been the same for a long time. What makes this surgery better?
Well, as Dr. Tucker was just saying, the ACL is made up of two parts anatomically, a front part and a back part. Historically, we've reconstructed just the front part to provide stability front to back, but the two bundles are necessary to help with rotational stability as well.
Now, why are only a few physicians offering this, or a few surgeons offering this right now?
Yeah. Technically and historically, the way we've done ACL surgeries in the past has been a good surgery. We're now trying to make it even better surgery. It's technically harder, and it takes a little bit of training, and it takes a little bit of practice to master it, I guess. So it's not something everybody's jumping into right away, because the old surgery is pretty good, but the new surgery is that much better.
And we're seeing a picture right there of the two grafts going through the knee.
Shows the front bundle and the back bundle going at different angles, and our goal is to prevent front to back movement and side-to-side rotational type movement with your sporting activities and your activities of daily living, and the goal is to prevent arthritis down the road and get you back functional doing your activities.
Now, who is spearheading this movement for change?
There's a doctor named Freddie Fu in Pittsburgh, and he's the guy in the United States who's kind of started all this probably 4 years ago. He has done hundreds of them now, and he's done a lot of research on it. And that's where Dr. Tucker went to train. That's where I went to train also, to watch him do some of the surgeries and to learn from him.
And so we're probably going to be hearing more about this. I know that women are more likely to have ACL injuries, right?
That's correct. Anatomically, women's knees are shaped a little bit different. The bone that surrounds the ACL is a little bit narrower. The muscle tone and the muscle structure doesn't fire the same way as it does in men. And then there's hormonal reasons. All these kind of add up. There's a lot of research going on in women and ACL injuries to try to hopefully prevent that and equal it out, or at least limit the number in females.
Very interesting. We hope to limit that. Well,
right.
Dr. Dixon, thank you so much for joining us this evening.
Thank you.
Thank you. Well, injuries are common in sports, but one team that's healthy, the Lady Indians, and the excitement is...
8 News at 6 with Diana Davis, Craig Rickert, Ryan Vaughn, and Glenn Marini.
It's an injury that sidelined some college athletes for an entire season, and it used to end some athletic careers. But fortunately for Diana here at the desk, her career not over, although she has had a tough time getting around the office for the past couple of weeks.
Yes, Craig, you may remember that I had a skiing accident back in December that resulted in the rupture of my ACL, or anterior cruciate ligament, and I was given the option to undergo a fairly new procedure when it comes to repairing ACLs. In fact, I am among one of the first 100 patients to undergo this procedure in Arkansas, and I would have to say this whole process has been quite a journey back from injury. This story contains graphic footage. Viewer discretion is advised.
I've been snow skiing since I was a teenager. My kids have been on skis since they were old enough to stand up, and none of us have ever had a bad accident, although we've had plenty of spills on the slopes. But one wrong move on a black slope in Minnesota last December sealed my fate for the next 6 months, possibly more. As I was falling, I felt a pop, then sharp, excruciating pain.
Hey, how are you?
Good.
Dr. Jimmy Tucker is an orthopedic surgeon in Little Rock.
We see a lot of snow skiers.
I was sent to Dr. Tucker after an MRI revealed an ACL tear in my right knee and some other possible complications.
Some concerns that you had some other injuries to your knee, and those turned out to be pretty mild, so I expect this is going to do great.
What Dr. Tucker is referring to is a fairly new procedure called double bundle. To understand it, we first have to look at how the femur and tibia meet to form the knee joint. The ACL, or anterior cruciate ligament, runs down the middle of the knee. It's a dense cord that can take up to 500 pounds of pressure before it tears. But one wrong move, a sharp pivot or turn, can result in injury. ASU Lady Indian Kelsey Locke required ACL reconstruction after this accident.
Your ACL is normally 2 bundles.
For years now, ACL repair surgery has been done with one bundle or graft. But this doctor says that's not good enough. Dr. Freddie Fu says ACL reconstruction should involve 2 bundles. His double bundle procedure has doctors like Tucker traveling to Pittsburgh to learn how it's done.
It was initially done in Japan. They started doing it about 6 years ago. And Dr. Freddie Fu in Pittsburgh is the person in the United States who started, the doctor in the United States who started doing them initially about 2 to 3 years ago. It's the bone coming out of the tunnel.
100 procedures later for Dr. Tucker, and I'm the patient on the operating table, and this is my knee. Using arthroscopy, Dr. Tucker uses a fiber optic telescope outfitted with a miniature television camera to make repairs through several very small incisions.
We're cleaning out your old ACL, and we're using a cautery type device to mark where the insertion sites were for the old ACL.
The wispy white ends you see are what's left of my old ACL following the ski accident.
This shaver is 4 millimeters, so it's smaller than a pencil.
Dr. Tucker leaves some pieces behind so that he can tell where to drill tunnels into my femur and tibia to anchor in the new ACL. It's an allograft, or tissue harvested from someone who has died and made the decision to be a tissue donor. The grafts themselves are only the size of a finger, but they look much larger on this video.
And you're about how far into the knee?
We're all the way to the back part of the knee.
As the first bundle is anchored into place, a second is on the way.
And there's the graft, and these sutures tell us how far it is.
It will take 2 to 3 months for my body to take over the graft and start building new cells. Meanwhile, the hard part begins, physical therapy.
It's like someone else has my leg and I'm fighting to get it back.
It's my first day to really work the new knee, and it doesn't want to cooperate.
The surgery is only one part of the rehab. You've got to do the exercise and the work after, because you can have a great surgery and that surgeon could have the most perfect surgery ever, but if you don't do the rehab, then it's your loss.
Quad sets, heel slides. There's a host of exercises we try to get gravity to make a bend in that stubborn knee.
Still sliding.
While age doesn't have anything to do with an ACL tear, I'm beginning to wonder.
I would say if it's a female, it's usually a younger athlete in school. So yes. But it shows how active you are, and you were trying to ski and stay involved with your kids, and I think that's very honorable. Very good.
Now, Craig, I'm 6 weeks past the surgery, and physical therapy is getting a little easier. I've gotten my knee to bend to 102 degrees, but I still have a long way to go. And as for the scarring, I think you'd be amazed. This is my knee now. Only 3 small holes remain as evidence that I had something done.
That camera under the desk right now, coincidentally. Just kidding. But I'm curious about this procedure, the double bundle. Why aren't more doctors doing it?
Well, Dr. Tucker says it comes down to this, Craig. With single bundles, there's equipment to guide surgeons as to where exactly to drill the holes to keep the bundle in place. With double bundle, a lot of equipment hasn't been developed yet, so the surgeon really has to rely on his understanding of where to drill the tunnels to anchor down the grafts. Many surgeons just don't feel comfortable doing this, but Dr. Tucker says in 5 years he thinks it will be commonplace. And incidentally, Dr. Brian Dixon, a Jonesboro orthopedic surgeon, also studied under Dr. Fu, and he has performed about 15 of these surgeries.
Could help a lot of people.
Yes, it's helping me.
Good. Glad you're back. All right. Well, still to come, a next look at our weather. Stick around.
Here's today's job of the day. Express personnel